What are TSI antibodies and thyroid blood tests? Imagine your immune system mistakenly targeting your own body instead of fighting infections. In some thyroid conditions, this can lead to the production of special antibodies called thyroid-stimulating immunoglobulins, or TSI antibodies. These are tiny proteins made by your immune system that specifically target the thyroid gland. They act like a key that fits into the receptor on thyroid cells, tricking the gland into thinking it needs to produce more thyroid hormones. As a result, the thyroid overproduces hormones, leading to a condition called hyperthyroidism. TSI antibodies are most commonly associated with Graves' disease, an autoimmune disorder where the immune system attacks the thyroid, causing it to become overactive. When doctors order blood tests to check thyroid health, they often measure the levels of these TSI antibodies. If the levels are high, it strongly suggests that Graves' disease is the cause of the hyperthyroidism. This helps doctors distinguish it from other thyroid problems, like thyroiditis or nodules, which may not involve these specific antibodies. The blood test for TSI is simple and usually involves drawing a small sample of blood without special preparation. The lab uses a technique called immunoassay to measure how much of these antibodies are present. If the results show elevated TSI levels, it indicates that the immune system is actively stimulating the thyroid. This information is very useful not only for diagnosis but also for monitoring how well treatment is working. For example, if TSI levels decrease over time, it may mean the disease is coming under control. In pregnancy, measuring TSI can also help assess the risk of the baby developing thyroid overactivity, known as neonatal thyrotoxicosis, especially if the mother has a history of Graves' disease. After treatment, doctors may also check TSI levels to see if the disease might relapse. In summary, TSI antibodies are specific immune proteins that cause the thyroid to produce too much hormone in autoimmune conditions like Graves' disease. Blood tests that detect these antibodies are essential tools for accurate diagnosis, ongoing management, and understanding the prognosis of autoimmune thyroid disorders. If you have concerns about your thyroid health, always consult a healthcare professional for personalized advice and testing.